So, as we were talking about the part of the humerus, we have seen that the distal part of a humerus contains many markings for the attachment, first of all, as well as for the movement, because of the all of the fossas posteriorly for the olecranon, anteriorly for the coronoid part, and as well as the radial part. In this case, they are mainly used for the movement such as flexion and extension, which is the main movement of the elbow joint. Continuing to the next part, what do we see here is the part of forearm, or also known as the antebrachium. And in the case of the antebrachium, you can see the two long type of the bones, which we call the ulna and the radius. This is the anterior view, and imagine it's in anatomical position where we do have the ulna always on the medial side and the radius always on the lateral side, as I told you. So in the case of the ulna, we do have again the proximal and the distal regions, as well as for the same for the radius. What would you mention here is that in the case of the both of these bones, the proximal part or head of the ulna is much bigger, right, than its distal end. In the case of the radius, everything is vice versa. So the smaller is the proximal one, and the bigger is always the distal. That's why even in the case of the wrist joint, we do have the mainly the radiocarpal type of the articulation, rather than, as we saw, yes, rather than a radio-ulnar carpal one, yes. So in a case of, let's talk a little bit more about the proximal attachment and, or proximal, sorry, end. In the case of proximal end, you remember ulna had this olecranon, the projection with a trochlear notch, as well as we had here the part of a coronoid process, also covered by the cartilage, as well as important thing, we do have here the part of the articulation with the head of the radius, and that is particularly seen sorry, that is particularly seen very well in this picture, which shows you the proximal end of the ulna. So additional to the part of the olecranon and its trochlear notch, as well as the coronoid process, you do have on the side of it, on the lateral side of it, you do have the invagination, which we call the radial notch. And here particularly we have the head of a radius is articulating directly with the ulna. As a result, we can say that we do have the proximal type of the articulation, we do have the distal type of the articulation, which is bone to bone, but in between of that two structures, you can see we do have the connective tissue membrane, which we call interosseous membrane, meaning that this membrane we have in between of the bones. Yes, interosseous membrane is literally means in between of the bones. I don't know what has happened with my computer. Okay, sorry, I really don't know what has happened. Just a second, please. Can you see my screen? Because I really don't know why it was black. Well, okay, let's continue. What do we have also on this region? So the part of the shaft here, the part of the shafts here on both of these sides, the radius has more interesting type of a shaft. You know why? Do you see here? It has the, we call it lateral convexity. So it is more like, you know, convex towards the lateral side. And by the way, this is the part of the also the attachment to the different muscles, this type of the irregularity, as well as you can see here the part of the radial tuberosity, which is also very close attachment towards the ulna. And here we do have the part of the articulation between the head of the ulna and the portion of the distal radius. And particularly in this case, you can see that in both of the cases, we do have the small projections, which we call the styloid processes On medially, it is the styloid process of the ulna, very small one because the ulna distally is very small, and the styloid process of the radius, which is localized more uh, more laterally, and it is much larger because the radius here and on its distal region and distal end is much larger. What else do we have on the posterior surface? If you can see, particularly here, it is more enlarged in this region, as you can see. So we do have part of a dorsal tubercle of the radius, as you can see, as well as it will be the producing from both of the sides the part of the uh, the part of the groove for the posteriorly localized muscles. And as I told you, mainly posteriorly type of muscles are extensors. So that's why here on the posterior side of a radius, we'll have the extensor pollicis longus. So this is the type of the muscle which is extending the thumb, because pollux means thumb, and as a result, this is the here we do have this groove for the muscle of the extensor pollicis longus, as you can see here. Now, what is also interesting for us is the part of the going down here, we do have also the grooves on both of the sides of this tubercle. We do have the grooves for the other extensors, and here comes the extensors carpi radialis, which is longus and brevis. So meaning that we do have the extensor of the hand at the wrist joint. Why carpi? Because carpi stands for the carpal bones. So it's crossing the carpal bones and attaches to the portion of the metacarpals as well as the phalanges as the result, because it is localized posteriorly. So in this region, that's why we do have the extension. That's why we call it the extensor. Now, in the case of the yes, here it is. This is the D and the E pictures, which are really very interesting for us. So this is particularly inferior view of distal ends of the ulna and the radius, as you can see. So, sorry, showing you the small part of the ulna where it has the place for the articular disc. That's why there is no direct attachment, as I told you, to the carpal bones normally. And also on the other side, we do have the portion of the radius, and here in case of a radius, we have directly the places, the facets for the attachment of the 2 out of 8 carpal bones. These are lunate, more medially localized, as you can see, and more laterally localized. This is the part of the scaphoid, as you can see. So as a result, the part of the interosseous membrane, this is the inferior view of the cross section, as you can see, through the part of the shaft. So through here, this is the cross section, and it's seen here how it looks like. So in between of them, we do have a part of interosseous membrane. By the way, the interosseous membrane takes important role in the attachment of the muscles, you know, really. In the attachment of the muscles, and most of the muscles of the deep layer, which are the closest to the ulna and the radius, they are having the attachment to the interosseous membrane too. So to continue with a part of the next region, what we have, this is the wrist mainly, and the part of the carpal bones, as we said. And here, what do you see? This is the part of the anterior view, and this is the part of the posterior view. So this is the palma, this is the dorsal view. Do you remember palma and dorsal? Yes. So in the case of the palmar view, you can see that the whole carpal bones are subdivided. They are 8, as we said, and they are subdivided into 2 main rows. One is proximal row, the one which you see here in the bluish color. And why it is proximal? Because it is closer to the origin, yes. And the second one, which is green one, this is the distal row, which you see here in the greenish color. Now, what are the representatives of that region, starting from more lateral towards the medial one. In the proximal row, we do have a part of the scaphoid, as you can see here. We do have a portion of the lunate, the triquetrum, and on the triquetrum, we do have from the palmar surface, we do have one of the smallest irregular bones, which we call the pisiform. So as a result, if we'll see from the posterior view or the dorsal view, you can see only 3 out of 4 bones of the proximal row. So you can see, if we'll talk about again from the lateral to the medial, so we can see that we have the scaphoid, as we said, we do have a lunate, and we do have a triquetrum, and on the anterior surface of the triquetrum, we have the structure which we call pisiform. Now, if we've talked about the inferior surface of the ulna and the radius, here you can see that particularly the radius contains the main articulation with a part of the scaphoid, as you can see here, as well as the portion of the lunate. You see how it happens? This is more lateral, this is more medial, yes, because it's the ulna. So in anatomical position, the scaphoid structure should be the lateral most, and this is the truth. You can see it very well here in this particular picture, where you have this bone of the scaphoid, the part of the lunate, triquetrum, and the portion of the pisiform. So that was that's what was about the proximal row. Now let's go through the distal row, which you see here in the greenish color. As a result, the very first one, this is the part of the trapezium. Then it comes a smaller structure, which we call trapezoid. Next one is the capitate, and the last one is hamate, with the anteriorly projected structure, which we call hook of the hamate. The same you can see particularly here. Again, this is the lateral view. This is the lateral side. This is the medial side. Yes. So why? Because in anatomical position, thumb is always laterally oriented. As a result, again, we do have the part of the trapezium, the trapezoid, the capitate, and the hamate, although the hook of the hamate is seen more on the anterior surface rather than in the case of the posterior surface. So sometimes in the questions, I can bring this type of the questions such as, which of the following is the correct medial to lateral order of the proximal row of carpals? Yeah, and as a result, you need to remember, I said medial lateral proximal row. I didn't say lateral medial. So medial lateral, sure, in anatomical position, yes. So as a result, we'll always start with a portion of the pisiform, then the part of a triquetrum, then the lunate, and then the scaphoid, and not vice versa. If there would be, for example, designation of lateral to medial, then yes, I agree with you. There should be scaphoid, lunate, triquetrum, and pisiform. When vice versa, so that's why please be very attentive in a question what I'm asking about. So, or the same I can ask in a case of a distal row. Okay, what is either lateral to medial, and as a result, you should start with the trapezium towards the part of a hamate, or vice versa, from the medial to the lateral, then from the hamate, capitate, trapezoid, and trapezium. That's what I want from you, to remember that particular names because it's important, okay? So the next part of the hand, bony structures, you can see that we do have, this is here the part of the, if these were the carpals, here we do have the metacarpals. So the metacarpals, as you can see, are composed of several parts. First of all, they are like they look like a long bones, which are having the region of the shaft, the part of the base which is more proximally localized always, and the part of the head with the small tubercles here. So as a result, we can see that we have the base, the shaft, the portion of the head of the metacarpals. So how many metacarpals do we have? Sure, 5 metacarpals, which are mainly producing the whole palmar or dorsal region of the hand. Sorry. The next thing, what do we have here? These are particularly the phalanges or phalanx. So how many phalanges do we have in this case? First of all, please remember that the thumb is the only type of the digit which contains only two phalanx, as you can see particularly here. One is the proximal, one is the distal phalanx, and that's all. In the case of all of the other digits, starting from a second towards the fifth one, so more medially localized ones, in this case we have always three phalanges, and these three phalanges are, I do believe it's clear, starting from the proximal most region, then we do have the medial one, and then we do have the distal one. So proximal, medial, and the distal phalanges are represented in the case of the 2 to 5th digits. Now, what are the main structures of the phalanges itself? Yes. So you can see here that anything what is anything what is closer to the proximal region, mainly this is the base of the phalanx, okay? So the base of the phalanx, then it comes the shaft of the phalanx, and then it comes the head of the phalanx, okay? So the head is always more distally localized rather than the base of the phalanx. That's what we need also to remember. And again, in a case of a hand, we do have a portion of the carpal region, so two rows of the carpal bones, as you remember, a part of the proximal carpal and a part of the distal carpal, yes? So in the case of the proximal carpal that we have, these are particularly starting from the lateral most towards the medialmost, starting with a portion of the scaphoid, then the part of the lunate, the portion of triquetrum, and the part of the pisiform. In case of the distal row, starting from the lateral most region, this is the trapezium, then the part of the trapezoid. What is the next one? Is the part of the capitate, and then the portion of hamate with a hook-like structure on the anterior surface. What is next one? What do we have in the next portion? These are the parts of the metacarpals, 5 of them. Here we also do have the portion of the phalanges. How many phalanges do we have? Normally 14, yes? Why 14? Because we have 3 in the 4 digits and 2 only in the thumb, yes, in both of the sides. Here particularly, you can see the bones of the right hand. What is more interesting here, according to the ossification of the bony structures, you can understand how old can be the individual, okay? So as a result, I do believe it's clear that in this case, we're talking about a small child. So it's approximately, as you can see, according to the distal end of the forearm and the hand of the 2.5 and 2.5 years old child, because the ossification centers of only 4 carpal bones are visible. So only 4 of them are seen. The others did not even start the ossification. That's why it looks like that. In the case of the E, what we can see, the distal end of the forearm. So look, the distal end of the forearm and a hand of an 11-year-old child. So ossification center of all carpal bones are already visible. That's why it's already approximately 11 years old child. Then you can they show you also the arrow indicating the part of the pisiform, which is lying on the anterior surface of the triquetrum, as you know normally how it is. So, and the distal part of the epiphysis of the ulna has ossified. So in this region, so the distal, this is the part of epiphysis of the ulna, is already ossified, as you can see. But you can see that there are still the lines which are remaining because there is no complete ossification. In case of the look, this is the part of the C where, yes, this one and this one. This is particularly the whole bones of the adult already with all of the ossification compared to here and here, because you see there is still some segmentation because the ossification is not complete. In the case of the picture C, there is no any segmentations because all of the bony structures have been ossified, and as a result, we are talking about the adult who is most commonly older than approximately 25 years of age. And although we don't have it here, but still. So why? Because approximately up to 25 years of age, we do have the complete ossification of all of the bony structures. You see? Now, the next portion, what we also have interesting here, just to show you, yeah, here is the surface anatomy with which I will finish for today. So here we do have a part of a surface anatomy. This is the anterior view. This is the posterior view. So most commonly what we can palpate, yes, on our body, for example, that's what is seen in this greenish color. So if we, like, for example, during the anatomical, during the physical examination, one of the things what we are doing, first of all, this is the observation, yes? So what we should observe, these are the, in case of the fit person, we should observe the different projection of the bony structures. A good example is, for example, the superior border of the clavicle. As you can see, you can even simply palpate it on your body, yes, where it comes towards the part of the manubrium. Although itself the manubrium is very difficult to palpate, but you can palpate in the middle here, you can palpate the part of the jugular notch, yes? So as a result, here you can see the part of a jugular notch, and on both of the sides of a jugular notch, we do have the formation of the S-shaped type of the clavicle. Now, continuing anteriorly to go through it, you can see that, and you can palpate it yourself. More in the fit people, it's the most projected. You can palpate the part of the greater tubercle. Sometimes they say that it's simple to palpate the lesser tubercle, and that's true. You can palpate it yourself. Even with my complexity, I mean with my BMI, I still can do that because it is very close to the surface. That's why you can see here the part of a lesser tubercle. From the anterior view, you can also see the part of the epicondyles on both of the sides. Yes, here. So they also can be very easily palpable, as well as the part of the styloid processes here on both of the sides. You can feel the part of the styloid processes of the ulna and the radius. Then more in the fit people, you can find the different carpal bones here. Although they say that the part of the hook of the hamate can be palpated, but that's not that easy, to be honest. As well as the part of the pisiform can be palpated, but still it's not that easy to make the palpation. Like more maybe for the hamate and the pisiform, which is more medially localized, right than the lateral ones. But whatever. So in the part of the metacarpals, head of the metacarpals are very clearly can be identified even without the palpation. So on the surface anatomy, it's very simple to see, as well as we do have the most of the phalanges are also having their demarcations, which is very simple to palpate, as well as to see in case of more fit individuals. Posteriorly, that's for sure that we can see the part of the scapula with its particular spine without even palpation. It is very well seen, and the whole borders, I mean the medial border, inferior angle, and the part of the lateral border are very well seen. As well as here, we do have the posterior border of the ulna. That's how it looks like. Also very well can be seen and palpated in this case. And sure, again, the same thing about the part of the phalanges and the portion of the metacarpals. In both of the cases, it will be anterior or posterior. They will be seen in both of these surfaces. So that's how it looks like, the part of a surface anatomy, which I want you to cover also till the part of the ossifications, I do believe. Bones of the upper limbs, here are the ossification information, but then it comes the part of the fractures. To be honest, I want you to go through the fracture of a scapula and the fracture of the humerus as a part of your homework. Also the fracture of a radius and ulna till, I'm not asking till tomorrow, I'm asking till the next Wednesday. Tomorrow we will continue with the explanation of the joints, but here, like this particular information, it's not that easy to go through till tomorrow and to understand it first of all. Yeah. So as a result, till tomorrow, you are having to go through some at least general information about the bones, okay? And then we will cover tomorrow the part of the joints, as I told you, and from the next week we'll continue with the muscular part of the upper limbs. All right. Now, do you have any questions? Yes, I can. Let me open the syllabus just a second, please. And I will just directly tell you what I need. So here is your syllabus, which is newly uploaded in the, if I remember correctly, in the March. Yeah. In case of anatomy, I need the first week, basic concepts, approaches to studying anatomy, regional anatomy, systemic anatomy, clinical anatomy, the part of the anatomical, so literally everything here, okay? The part of the back and so on. Oh, sorry. The next one, I need everything about the back. So the week 2, I need week 3 with the thorax. Is everything. I need week 4 with the part of the upper limb. Okay. I need continuation week 5, as you can see here. So the part of the joints, as you can see. And I need the week 6 for the upper limb muscles. That's all. That's the only thing what I need from you for the midterm one. Okay. So we have covered the part of the overview here and the bones of it. Tomorrow I will cover the portion of the joints, and on next week I will cover the part of the upper limb, as you can see here, particularly the muscular region. But just a second, I think there are more. Yeah, so it means that here are the muscles, as you can see. These are the muscles of the upper limb. So just a pectoral and a scapular region. You can see, do have the arm, axillar arm, and the muscles of the arm, without the muscles of the forearm. Okay, you see. So first 6 weeks of the anatomy will be for sure included in your midterm. Is that clear? Good. Do you have any other questions? Okay, so thank you so much, my dears. Have a nice evening.